Okay, imagine you're young, active, living by the beach, and just starting out in your career. Then things go awfully wrong. You go to the doctor and get the devastating news that you have a serious chronic disease. Well, that's what happened to my next guest, Jordan, 6 years ago when he was just 27. His diagnosis, ulcerative colitis. Now, Jordan says the news changed his life. Here's his story.
In March of 2010, I started suffering from severe cramping, along with multiple trips to the bathroom. There was something serious going on, and I had to see a doctor. I had colonoscopy, and in June of 2010, I was diagnosed with ulcerative colitis. My doctor gave me some medication to get on right away. I was very hopeful that this was going to keep my symptoms at bay for the rest of my life. After about 18 months, my symptoms came back with a vengeance. It had gotten so bad that I went from about 165 pounds to about 130 pounds in a matter of 6 weeks. I was desperate for some relief for my symptoms.
Get my colon removed tomorrow.
My first surgery was in October of 2012, and my final procedure was in March of 2013. I do have some scars. I wear them as badges of honor. Life right now is amazing, and every day is a good day.
Well, Jordan is joining me along with our very good friend and Chief Medical Officer of Pfizer, Dr. Frieda Lewis-Hall. So welcome to you guys. Well, Jordan, had you ever heard of ulcerative colitis before your diagnosis?
No, not at all. Like most ulcerative colitis patients, I had never heard of this disease before. There was no family history. I considered myself to be kind of the picture of health.
So, Dr. Frieda, what exactly is ulcerative colitis? And is it unusual to show up in someone as young as Jordan?
So, ulcerative colitis is an inflammatory bowel disease that affects the large intestine. So researchers believe that bacteria and or viruses may mistakenly trigger our body's immune response to attack the inner lining of the large intestine. The inflammation leads to the symptoms that we see. And the disease is called ulcerative colitis, and it attacks the innermost lining of the colon, and it causes ulcers there.
Well, who gets it and when and why?
It is most commonly diagnosed in people who are under the age of 30 and over the age of 60. Now, it can strike at any time, but it affects men and women about equally, and it's estimated that there are about 700,000 people in the US that have it.
Wow.
Now, as to the why, well, we don't exactly know the cause of ulcerative colitis, but the evidence points to a combination of factors. Family history, the immune response, which I just mentioned, and then there are environmental factors like stress and diet.
So, Jordan, what were some of the signs that you knew something's not right here?
I had severe stomach pain. I was literally running to the bathroom 25 to 30 times a day. This led to me not being able to eat. So my quality of life, as you can imagine, went down to zero.
Wow.
Jordan really mentioned most of the symptoms that people end up having. Now, there are other symptoms, which can include like bloody stools, fever, fatigue, and weight loss. And this is really important to understand about ulcerative colitis, and that is, unless it is diagnosed early and effectively managed, people with ulcerative colitis can be at risk for very serious outcomes like perforations of their colon, severe dehydration, as well as be at increased risk for colon cancer and blood clots.
Wow. So how did your life change after you got the diagnosis?
So I actually had to have my entire colon removed. But ever since then, I'm back on track and living what we call like a new normal life.
Right.
Now, with early intervention, many people can effectively manage ulcerative colitis with diet and with medications. But as in Jordan's case, sometimes it's necessary to remove a part or the entire colon. And so it's very important to also ask the healthcare team to help get counseling and support services so that you can really learn how to deal with these life-changing effects of the disease and learn how to navigate every day to this new normal.
Did you have that important support?
I definitely did. Growing up in an Italian household, I became a little bit of a mama's boy, I can admit it. So I did have a strong support system, and then I've been able to get my professional career back on track.
And friends and family support is so important when you're dealing with any illness. And information is key to helping them understand any disease, certainly something like ulcerative colitis, which a lot of people just don't know about. Now, if you or someone you know has ulcerative colitis, take my advice, go straight to gethealthystayhealthy.com for more information on this disease.
You know, and there's a lot that we still don't know about ulcerative colitis. So the other thing that's important is if you're diagnosed with it, you might want to talk to your doctor about participating in a clinical trial,
Right.
which would help learn about new potential therapies. And of course, if people want to learn more about clinical trials or ulcerative colitis, they can go to gethealthystayhealthy.com. And while they're there, they can sign up for our monthly newsletter.
Look, I want to thank all of my guests today, especially our friend Dr. Freda Lewis Hall. And thank you for being willing to come talk about this, because I know it's not a fun thing to talk about, but you've become an advocate for it,
Yes,
and
sir.
that is helpful. So thank you for that.